So this is part one of the SCIPE Bedside QST training. This is kind of the introduction to QST for the spinal cord injury pain evolution study. So I've just put a couple of references up here for people who may be interested in getting more details about quantitative sensory testing and what it is used for and what different tests mean. I think these are very good reference articles if you're interested in looking them up. So the first part of this is really mostly general considerations that we think about when we're doing this type of testing. When you do these types of tests, we definitely want to make sure that we are standardizing the presentation of the stimuli. You do that when you're doing a study that's only at one site, but it's certainly much more important when you're doing a multi-site study. So we want to make sure that we're standardizing the presentation of the stimuli each time that we do it, and that we don't get lazy after we've done it a few times. And we want to make sure that if we're supposed to present the stimulus for 1 second, that we count that 1 second in our head and don't try to rush things along. We want to standardize the instructions. We have developed a written script. The script should be read to the participant. And you can answer questions. You may want to elaborate on the script if the person doesn't seem to understand the instructions, but we do want to try to limit how much we go off script or embellish on the script, because we don't want to impose any biases or expectations for the person. What we feel, what I personally feel for some of these stimuli is not going to be the same that someone else feels. So I don't want to try to put words into their mouth, and that's why we have a written script that we should follow. But again, we can answer questions and we can try to clarify things. In answering their questions, of course, we'll reassure them. You can tell them that you have experienced all of the stimuli, that we have tested these stimuli on other participants, and that they cannot be harmful to them in any long-term sort of capacity. So we want to stick by the appropriate minimum time between the tests. And the reason we want to do that is because if we present, we know that particularly for painful stimuli, noxious stimuli, if we present them closely after one another, we can most certainly influence the results of the second test because of the first test, because of the way that our body processes this information. If we don't go by the minimum time that we have included in our instructions, the minimum time between the tests, we may be affecting the subsequent tests, the results from the subsequent tests. And the way that we have ordered the tests in general is so that we present the non-noxious or innocuous stimuli before we present the more painful stimuli. Again, this is to try to reduce the influence of sort of the pain stimuli when we're on some of the non-painful stimuli that we're measuring. So we have chosen a particular order for a reason. We need to abide by the minimum time between tests. We need to follow the written script even after you have become very familiar with this and you have done it on several participants. It's important not to stray from the script and try to read it the same way to everyone, and to answer questions along the way as needed. When we are performing the tests, we need to set the expectation for the participant before we even start that this is, a serious test. We want to make sure that they're not on the phone, that they're not talking with others, that maybe the TV is off. If they have a TV in the room, that because we are going to be asking them to tune into their sensations, they need to be able to attend to that. So we want to minimize distractions. Again, standard presentation of the stimuli, make sure that each time you do it, you try to do it in the same way. We will always have a practice test, and we've chosen to do that on the left cheek, and that will help the participant understand the instructions, know what to sort of expect, know that the stimulus is not going to be that bad. And then that way we can use the practice test before we do the first test on the right side, which is when we will be starting to collect the data. When we present stimuli, sometimes the participants want us to do it over. Wait a minute, I didn't feel that right. I'm not sure if I felt it. Can you do it over? We try not to do that. We have to accept that there is some variability in measurement and people's perceptions from moment to moment. If, however, something happened, the person started to fall asleep, or maybe somebody came into the room right as you were doing that last test, if there's an obvious distraction that could have affected the participant's perception, then we can do it over. Again, remember to wait that minimum period of time before you do that trial again. Also, when people, sometimes you have to weigh this, it's a little bit difficult. Sometimes participants will ask a lot of questions and you don't, again, you want to provide some assistance. You certainly want to answer their questions, but try not to bias their responses. And we do want to ensure that the participants understand the instructions. So it's important when you do that practice test on the left cheek that you make sure that you ask all of the questions that you would ask during a regular trial. You know, ask for an unpleasantness rating and a painful rating. Ask if if there was anything unusual about the sensation, or you know, if they felt it. And in that way, we can make sure that the participant understands the instructions before we move on to the real test sites where we will start to collect data. Because what we don't want to do is do the first several tests and then realize that the participant doesn't understand the instructions and then have to go back and redo those. Okay, that is the first part. That's the introductory part. We'll stop this recording for this part.